after that first 24 hours, you're gonna start to feel some pain, and it's gonna be a big, huge mouthful. You're gonna have to push through this. Get through to that 72 hours. 72 hours, that swelling is going to start to subside, and if you feel sore areas, have your provider adjust those. After the 72 hours, you're gonna start to feel better. This is kind of the light towards the end of the tunnel, not quite there yet. After 72 hours, you're gonna be able to eat a few more things that you weren't able to eat before. Do not go too crazy with your diet. In my office, I give the patient a soft reline that cushions the denture up and restabilizes it because the swelling's gone down and the denture wants to move around and it feels really wonky in your mouth. So at about 7 to 10 days out, ask for that soft reline if it's not already scheduled. That's gonna be your first breath of fresh air. After that, your tissues are starting to heal. Those holes are closed up pretty good. There's really no blood in your mouth. The stitches are still there if you had stitches. Just be careful with those. If there's any little ends that are dangling out and bugging you, just take a little tiny little nail scissors and just trim the little ends, not the loops, but the ends that might be poking out. If you need a little pain relief, there is a product called Hurricane, and I really like it. It's the same kind of topical numbing agent that a dentist will put in your mouth before they give you a shot to numb you. You can find this on Amazon. It's usually also available at a pharmacy counter at your local drugstore, and it doesn't taste horrible. If you can't find Hurricane, then Benzodent is also a good product. You can find that on Amazon as well. I have links to that if you go to my link tree, and the Hurricane, but you can find that anywhere. So you can put those on those areas that are really, really hurting you. And after the 72 hours, you can sleep without the dentures. It's important though to keep those dentures in all the time after you get your teeth pulled, because it's acting as a bandage over those sockets to protect those areas, but it's also helping to form your ridge. When you don't wear those dentures, you're not healing in the parameters of those dentures. So if you just take them out because they hurt, you might just heal kind of arbitrarily, kind of wherever your gums settle, and sometimes they kind of flatten out. So it's really important that you communicate with your provider and try to get those dentures fitting comfortably enough so that you can keep them in your mouth, because it's helping to form that ridge. I hope that you guys can get the access to your providers. I really give my patients unlimited access to me in that first 6 months of healing, because they need adjustments and they need soft relines during that time. I only do 2 in 6 months because I don't want to thicken the denture up too much.